Hi everyone, this is Dr. Ty Vincent, talking about low-dose immunotherapy for the use of food reactions, but also this video I want to talk about food reactions that are not actually food allergies. So I see patients fairly regularly who will tell me that they have all sorts of symptoms occur after they eat. And in some of these cases, it doesn't matter what it is that they eat. They often get the impression that they have a lot of different allergies, that they're allergic or sensitive to all these different foods. They only have a small number of safe foods. They'll often want to tell me, hey, it's easier to list the foods I can eat than all the foods that I can't eat. And then the most key question I have for those people is, well, do you react in the same manner to all those different foods? Do they all cause the same kind of symptoms? And in a lot of those situations, the answer is yes. Because it's just statistically unlikely that you would have direct food allergies to 100 different foods or even 20 different foods. It's just kind of numerically not that likely. And when people do have direct immune-mediated food allergy reactions, it's common that they have different symptoms and different kinds of reactions to different foods. If you're allergic to a few foods and they all cause similar symptoms, that's within reason. But when somebody says, oh yeah, these 25, 30, 50 foods or whatever, and they all cause the same symptoms, you're usually not actually allergic to those foods themselves. So there are a few other explanations. One that's actually increasingly common these days is you could be sensitive to chemicals. Chemicals are in virtually all the foods that you eat, unless you grow the foods yourself at home and you know for a fact you didn't put anything in the ground agriculturally or anything. Or you shot your own wild animal or you caught your own wild fish, then you can be much more certain that there's not a substantial amount of any chemical in there. But if you buy your food at the grocery store, even if it's an organic produce item, it will be sprayed and treated with various chemicals after picking so it maintains freshness during transportation. And those chemicals don't have to be disclosed to you. Even a processed food item that's labeled organic is allowed to have all kinds of chemicals in it still and still be called organic. There are chemicals allowed in the raising of animals and produce items that are still allowed, and you can still label it organic because organic has a legal definition, and the industry lobbies the government to decide what fits under that legal definition. So pretty much any food you buy at the grocery store or have a restaurant for sure is likely to have various chemicals in it. So if you have similar food reactions to a wide array of different foods, or if you notice that you have problems when you eat processed food items or you eat out at restaurants, but you can eat those items, the same kinds of foods, in a whole food organic sort of way and have no problems, then it's probably the chemicals that are in the processed food or the restaurant food that you're reacting to. So we have a really good success treating that scenario with the chemical LDI mixture. And that's becoming more and more common. These things confuse people. They think they have food sensitivities, but then that's not what's going on. So eliminating different foods doesn't work. Doing various types of immune therapy to desensitize you to food specifically doesn't work either. So we find this out along the way. Another possible issue, mainly isolated to the GI tract, but can cause some other multi-system symptoms, is if you have a sensitivity to some organism that lives in your gut. Yeast, various protozoa, bacteria of all sorts, worms, let's say. Everything that lives in your gut also eats the food that you eat. And there will be particular types of foods that feed these organisms preferentially. So if you have a sensitivity to some kind of gut organism, certain gut flora aspects, and you're feeding that with a particular type of food, then you'll have a reaction. Those reactions are usually delayed. They're not right away. Like if you eat a food and you have a reaction within an hour, you're reacting to that food or something in that food probably. It's less likely that you have a reaction to a microorganism because those secondary reactions to microbes take a little while for those organisms to eat the food you ate and to multiply their numbers and to reach that threshold of effect where you have more symptoms increase. So the way to sort this out with different people is to ask all these different questions, to lead people through the thought process, come up with a strategy. There are a number of different ways we can approach this problem. Sometimes it's a digestive issue or a physiologic issue that isn't even immune related, and we can sort those things out too. So just keep this in mind. If you're frustrated and you've tried different diets and eliminating this and that and you still can't seem to figure it out, there's a really good chance we can help you sort through it, and there's a good chance that LDI can help solve it. If it turns out you're reacting to chemicals or you're reacting to some gut flora, There are a lot of ways to try to figure this out for people, and we're happy to do that.